topical steroid abuse with HPA axis suppression and secondary adrenal insufficiency. He even had tinea corporis and was diagnosed to be a de novo hypertensive. So patient is on regular follow-up since last May till date. He is actually currently admitted in our ICU also. So coming to Cushing syndrome. So Cushing syndrome is a group of clinical symptoms that occurs because of chronic exposure to exogenous glucocorticoids. It can be endogenous or exogenous. So the most common cause is actually an exogenous Cushing syndrome where we have steroid abuse. So this is a picture demonstrating hypothalamic pituitary axis. So cortisol is actually a stress hormone. So in response to physical and emotional stress, hypoglycemia or pain, it stimulates our hypothalamus to secrete CRH, which in turn will stimulate the anterior lobe of pituitary to secrete ACTH. That will act on the adrenal cortex to secrete cortisol. So in a normal individual, the circadian rhythm is like there is high production of cortisol early in the morning, and as the day progresses, the production decreases. So in Cushing syndrome, this circadian rhythm is lost and there is hypercortisolemia throughout the day, and also there is disturbed negative feedback mechanism. So this is a slide showing the classification of Cushing syndrome. So once endogenous Cushing syndrome is confirmed, we have to then identify the cause for it, whether it is ACTH dependent or ACTH independent. So ACTH dependent are basically pituitary adenomas producing lot of ACTH, or ectopic ACTH syndrome where we have other tumors producing ACTH. So ACTH independent causes would be adrenal causes like adrenal adenoma and adrenal carcinoma. So these are few clinical features as we have seen images before and their respective discriminant indices. So as you can see, easy bruising in myopathy, hypertension, plethora have very high discriminative index. That is, these features are specific to Cushing syndrome and it can distinguish Cushing from a pseudo-Cushing state like obesity, pregnancy and other causes of increased abdominal distension. So this is another flow chart to how to evaluate a case of Cushing syndrome. So once you clinically suspect someone is having Cushing